Thank you everyone for joining today. We will get started in just about 1 minute. Thank you for your patience as everyone joins the webinar feed.
Okay, it looks like we've got a great group coming together. So I think we can get started. My name is Lauren Kennedy. I'm the co-founder of Neighborhood Villages, a systems change organization that builds, implements, and advocates for sustainable policy solutions to fixing the early education and care crisis. We're so thrilled that you've joined us and Strategies for Children and a great group of speakers today to talk about one of the most impactful investments that have been made in the early education and care sector, probably in decades. Direct-to-provider grants that provide foundational funding to cover childcare operating expenses. And we'll also talk about why we need to see these grants become a permanent feature of the Massachusetts childcare sector. In addition to having launched an innovative, highly successful response to the pandemic and its reverberating challenges, Massachusetts now has, with this grant program, the opportunity to set forth a model, a new way of thinking about childcare financing that will help us to advance toward a childcare program that meets the access and affordability needs of families and that provides the public dollars needed to see increased compensation for teachers and greater systems stability. We're fortunate to be joined today by the co-chairs of the Massachusetts Joint Committee on Education, Representative Alice Peisch and Senator Jason Lewis, who will join us a little bit later in the program. And we're also fortunate to be joined by Massachusetts providers. It's their stories and their experiences that speak the loudest about just how critical this program has been and what it will mean for their programs to see it sustained and hopefully to become permanent. With that, I will pass the mic over to Amy O'Leary from Strategies for Children.
Thank you so much, Lauren. It's great to be here. I'm Amy O'Leary, the Executive Director of Strategies for Children, and we work to advocate to make sure that Massachusetts invests the resources needed for children birth through age 5. I'm so excited to introduce Representative Alice Peisch, and we know that Senator Lewis will be joining us. We are especially grateful for your leadership throughout the pandemic and health crisis. To say that the decisions made by leaders in the administration and the legislature over the last 3 years may sound dramatic, but I believe it to be true. Your commitment and dedication to better understand, listen and learn from educators and providers, ask questions, visit programs, hold focus groups, and work in partnership with advocates, business leaders, and your colleagues in the legislature had a tremendous impact. From setting up emergency childcare in a matter of days to supporting COVID testing for children, families, and staff, to listening to the field when drafting responsive new policies to ensure safety and health, to funding programs to stay open and to supporting parent choices about when to send their children back to programs, and the creation and continued funding for operational grants to stabilize our early education and care system. The roadmap outlined in the legislature's Economic Review Commission report released in March 2021 will help us tackle many of these persistent challenges. We have seen historic levels of investment from the federal, state, and local levels, and we know the FY23 state budget passed in July and the economic development bill signed into law in November provided millions of dollars to support young children and their early education and care in Massachusetts, including $490 million in a newly established high quality early education and care affordability fund and over $3 million in funding to continue the operational grants. We also have heard incredible news about a pilot started through the existing financial system program designed to provide immediate access to vouchers for income eligible staff working in licensed early education and care programs. And we know that hundreds of staff have accessed this funding, called to access the funding. Earlier this month, now it's last month, the legislature kicked off the 2-year legislative session that ends in 2024. And we know that thousands of bills have been filed for consideration this session. We know that today it is an incredibly busy time, and we're so delighted to have you here with us, Representative Peich. I'll turn things over to you.
Thank you very much, Amy, for that very generous introduction, and thank you, Lauren, for both you and Lauren for putting this panel together this afternoon. Before getting into any details, and I'll try to be very brief, I do want to reiterate something I have said in the past, particularly given who is in attendance this afternoon, and that is just to express my gratitude and appreciation for all of the work that the early education and care providers provided during the pandemic. It continued to provided before the pandemic, but I just want to emphasize how much I appreciate the fact Amy referenced the emergency early care getting up very quickly. Those of you who are engaged in that, at the time were putting your lives and your family's lives at risk to do it. And I think while there were, many other essential workers that did that, I am particularly grateful for the fact that you did it, because many of those other essential workers would not have been able to work had the providers not been willing to do so. So I will never forget that. And I think that while I have been very aware and trying for quite some time to expand access to high quality child care for all those children in Massachusetts who need it. I think it wasn't until the pandemic that it became obvious to many more people just how important this work is and how critical it is in two areas: economic development. People can't go to work if their kids aren't taken care of, and the ability of children to be successful when they get into the K-12 system. So for both of these reasons, there's been a new and renewed focus on this. Amy's mentioned the commission, which came out with its recommendations actually less than a year ago. Seems like an eternity, but included in those recommendations was the recognition that the C3 grants needed to continue at least until the system was stabilized. I'm not sure how long that will be. And the other recommendations of the commission really are designed to ensure that we finally get to the place where we have something that we can call a system. I won't go into the specifics, but there are a lot of, I think, really strong recommendations and doable recommendations in that report. And we started to implement them in the budget for FY23 with, as Amy mentioned, several significant new initiatives. So I'm hopeful that will continue, and I'm confident that it will, because we have had the support over the past couple of years, and I know we continue to have the support of the leadership in the House, Speaker Mariano, as well as Aaron Mikowitz, the chair of the Ways and Means Committee. So I look forward to hearing what the panel has to say, and to working with all of you during the course of this session as we try to move forward with some legislation that will address your concerns. Thank you very much.
And I know we're going to Amherst next, but Rep. Peich, I just want to make sure you see the appreciation that's floating on our screens and in chat and Q&A. So I will turn things over to Amherst.
Thank you so much, Representative Peich, and thank you everyone for participating. As I share my screen now, if you have specific questions that you would like to be addressed, please feel free to use the Q&A, and there will be folks behind the scenes to address those questions. And also, obviously, you can continue using the chat to engage. So my name is Amherst Kinney. I'm the Director of Research at Neighborhood Villages, and we are so grateful to have you all here today. Our high-level agenda today will be to demonstrate the impact that C3 grants have had on the field, and how the data from this grant program demonstrates the critical role that direct-to-provider grants play in helping us to sustain the progress we've made since the pandemic and embark on a path toward a better childcare system. We will do that through data and through providers' voices. So the Department of Early Education and Care in the last 2 months has shared findings on the impact of the grants, and we will let those numbers speak for themselves. Then we will hear from providers who have benefited from those grants on what they mean for their ability to run programs. And I will just add that when Senator Lewis is able to join us, we might have some of the slides interrupted, and we are grateful to hear from him when he joins, and we'll just pick up where we left off. So what we hope you take away from this panel can be summed up in the words of the providers, which you see on your screen, and which convey the following. The operations grants, beyond being a lifeline for providers, serve as the mechanism by which we can take important steps toward increased access for families, increased worker compensation, and improved affordability. Direct-to-provider grants were designed for stabilization, but have proved to be highly impactful and essential to the field's long-term ability to enroll children while avoiding tuition hikes and to raise educator wages. The financial origin of these grants is that the federal and state government early in the pandemic recognized the need to stabilize a field that was essential and reeling. The Commonwealth received hundreds of millions in federal dollars of relief funds. A big portion of the funds appropriated through ARPA was allocated for childcare stabilization, and Massachusetts designed an innovative distribution model direct to provider grants called Commonwealth Cares for Children, which we refer to as C3. Over the course of the C3 program, the Commonwealth appropriated significant funds as well. These state funds have been critical to ensuring that the grant could continue. These funds were made available to the field as a whole, with additional funds allocated to programs that participate in the state's subsidy system. Oh, excuse me. The purpose of the funding was really to allow providers who were suffering from reduced enrollment resulting from the pandemic to stay open and serve families. The state designed a way to distribute funds in such a way as to support the field as a whole, while ensuring that it accounted for higher expenses related to serving children in low-income communities. So the funding formula as currently constructed accounts for stabilization, and the C3 program was successful at achieving that initial goal of stabilization. What data from the C3 grant program and what you'll hear from providers, what it shows us is that these grants are not just critical for stabilization, but that they will play a key role in sustaining the positive impacts of the operations grants, and that they provide a huge opportunity to advance our goals towards building a stronger and more equitable childcare system. Both providers and EEC have made clear that operations grants must be the future of childcare financing if we are to achieve our goals with respect to workforce compensation, family affordability and access, and quality. So now we'll look at some of the data. How do these grants relate to access? Well, as is often the case, the most vulnerable providers in the early education and care sector are those located in areas with higher social vulnerability, a measurement from the CDC known as SVI. This matters because they also serve the most vulnerable children, and so their ability to remain open has direct implications for how we ensure equitable access to early education and care. Programs are unable to fill all of their available seats right now, mainly as a result of understaffing. And operations grants serve as a mechanism with which providers can work to address that challenge. In fact, we know from recent survey data that more than 12%, that's nearly 1 in 8, providers are at risk of closing their doors without continued support in the form of operations grants. On top of the risk of fewer providers in the field, we continue to face the challenge that there are fewer spaces available with existing providers because classrooms cannot be staffed. A big part of that staffing challenge is an inability to attract and retain educators because of low wages. Operations grants allow providers to raise wages and recruit and retain more educators. The Department of Early Education and Care estimates that if early education providers had the staff they needed to operate at full capacity, we would be serving an additional 15,000 children and their families. These funds are available, the operations grants, the C3 funding, are available to all licensed providers. But as already mentioned, the C3 program was designed to specifically address the need for different levels of funding depending on a program's circumstances. The formula includes an adjustment for proportion of children served with high social vulnerability. At the same time, the formula acknowledges that both subsidized and private pay programs serve vulnerable children and families. And the data suggests that the formula is working as intended, as funding has disproportionately gone to programs serving the most vulnerable children. We see that providers serving children with childcare subsidies have received 64% of all approved grant funds. Without these grants, we will not be able to achieve our goals with respect to making care more accessible or affordable, or for investing in our teacher workforce. And in fact, what the data suggests is that we will regress, due in large part because more and more teachers will leave the field because of inadequate compensation. So I keep mentioning the low pay of the early child educator workforce as being a driver of under-enrollment of children. And for concrete evidence of what that means, we look at the average wages of these professionals, and they are professionals in the field, which are well below the living wage for families in Massachusetts. What you see in the graph is the midpoint of hourly earnings for different positions in July of 2021, that's the blue bars, just before C3 got underway. And in this past October, this is the orange bars. And there are two particularly noteworthy things in this graph. The first is that early educators in Massachusetts are paid poverty wages. The reason for this is that there is no public mechanism by which to offset increases in wages. Any increase to labor must be offset through an increase in tuition, and families simply cannot afford to pay more. But the second thing we see is that wages have increased because many providers have used the C3 funding to serve as that offset. So putting public money into the programs has the impact we need to see. And if we want this positive trend to continue, we need to continue the investment. And as difficult as the current climate is for early education and care workforce, it will deteriorate further in the absence of operations grants. The data tell us that 65% of childcare centers would have to defer planned compensation improvements, and that more than half of all programs would have to reduce compensation. That 40% of childcare centers and, of center-based providers and 20% of family childcare providers would reduce supports for educators. and that 38% of childcare centers and 22% of family childcare centers would reduce staffing levels. While this is the reality, providers would also like to be able to raise wages, as evidenced by how they have used the C3 funds. So we see that 83% of center-based providers who received operations grants and 41% of FCC providers allocated grant funds to worker compensation. And providers cite that offering more competitive salaries, has been critical for successful teacher recruitment and retention. Most center-based providers have used the funds to improve worker compensation, and many family childcare providers have as well. In the midst of high turnover, providers have relied on that funding for increases in wages to recruit and retain staff. So operations grants, which provide public funds to cover operating costs, including labor costs, finally offered a means by which providers could raise wages without having to raise tuition. Providers have spent almost 60% of their funds on existing payroll and benefits, past costs, and other operational expenses. What we know is that increases must be maintained, otherwise the workforce crisis will worsen and access and affordability will suffer. And we see that 81% of center-based providers and 52% of family child care providers report that they would increase educator salaries and their own compensation if the C3 grant were extended. Yet, despite the positive impact of operations funding, the workforce crisis continues. Most programs are hiring for multiple positions. On average, the programs that are hiring for 3.6 positions. And many programs are losing educators who are leaving the field altogether, likely for their own financial interest and well-being. About a third of educator positions have turned over in the past year, and much of that turnover is attributed to staff leaving the position in the sector for something else outside of it. In a moment, we will get to the exciting part and hear directly from providers. But we want to also point out that in addition to the critical nature of operations grants for the workforce, they're also essential to ensure family affordability. Because as previously discussed, the only way for providers to increase revenue in the absence of public support is to pass the cost on to parents through increased tuition. With operations funding through the C3 grant program, more than 25% of all providers were able to defer planned tuition increases. On the other hand, in the absence of operations funding, 61% of providers would have to increase tuition rates, which would mean families facing an additional financial burden or providers exiting the field. So that's a lot of data and information, and I'm gonna go ahead and stop there, and I'm gonna turn it over to Amy O'Leary, who will introduce our esteemed provider panelists.
Thanks so much, Amaris, and for that incredible source of data. We're delighted to welcome our panelists. So if you will join me on camera. We have Melanie Asaro, who is the preschool director at the Elizabeth Peabody House. We have Ellen Dietrich, the senior director of learning and engagement and Temple Beth Shalom in Needham, and the co-founder of the Paradigm Project, a national organization that supports early educators in Jewish schools, and Kate Barant, the CEO of Horizons for Homeless Children. As we get the discussion started, I wanted to recognize and acknowledge family child care providers. Their voice is not represented in our panel today, as it can be difficult for family child care providers to participate in events that run between 9 and 5, as they are often with children. I want to highlight that the data that Amara shared, we could see responses both from center and family child care settings. And some additional data for family child care programs include that more than half, 53% of family child care licensees report spending between 41 and 50 hours per week with children. And almost half, 45%, report an additional 10 per hours per week on tasks tasks not with children, but outside their time with children. So we know that family child care providers have a unique situation where they are typically one provider with 6 children, 6 to 10 children in their homes. And we just wanted to acknowledge and thank them for the work that they're doing today. We also know with 90% participation rate of programs participating in the grant program, we now have close to real-time data from more programs than we ever had before. We are grateful for the Department of Early Education and Care for collecting this data and to the programs for reporting it. So now let's hear from our panelists. As we get started, can you each tell us a little bit about your program, the families and communities that you serve, and what it's like for you to be a provider right now? And then finally, how have these operational grants impacted your program? So why don't we start with Melanie?
Hi, I'm Melanie. As you said, I am the preschool director here at the Elizabeth Peabody House in Somerville, Mass. So our program, we serve a real diverse community. We have 2 preschool classrooms. They run from ages 2.9 to 5. And we also have an after-school program that runs from 5 to 13. We are able to provide a high quality of care to our families. And that's something that we strive for. We believe that all of the children that we serve and all the children that could possibly come to our center, they deserve the highest quality of care that we can provide. And with that being said, with this grant and the funding, we're able to provide that. We're able to have the teachers that we have retain them, and also to create positions that can help support our program. We did with this money too, we were able to create a full-time site coordinator position, which in turn would give benefits to our employee. That's something, that's super important. All of our staff, they work super hard. It's important to be able to reflect that upon them, to make sure that, they're getting paid to be able to support the cost of living. So with this funding, we're able to increase their salaries for that. And then again, like I said, to retain them. We had a teacher here she's been here almost 5 years now. And she's gotten her bachelor's while she's here with us. She's working on her master's. And again, with this funding, we were able to retain her. We were able to reflect all of the hard work that she's put in for her education to be able to bring back to our program. And again, to instill a high quality of care. So that was really important to make sure that we could help compensate that for her. Because in all honesty, I don't know if we'd be able to keep her without that funding. Right. Again, she works so hard. So, it's nice to be able to reflect these back onto our staff, because again, they work so hard. COVID put that in perspective for us. It was almost like teachers had to reinvent the wheel in a way to come back from COVID, to be able to teach our children still quality of care, but also to bring on all of the extra regs and that we needed to provide to make sure that everyone stays healthy, So this was really important for us.
Thank you, Melanie.
You're
Ellen,
welcome.
what about you?
Everything Melanie said really resonates. I'm Ellen Dietrich at Temple Beth Shalom in Needham, and we have about 220 children ages 1 to 5, and we draw from the Needham and surrounding towns. And we also have used the funds to supplement and to raise faculty salaries. We have about 60 teachers, and we've gotten the base salary to $45,000, which is amazing, and it's not enough. And I think that that table in the couple slides ago really spoke to me, because that is not $35 an hour that you need to live in Needham and Newton and Dedham and Dover to be close enough to work for a reasonable commute. That's $22 an hour. So although we were able to use these funds to raise the salaries, it's still not enough to be able to live in the community that you're serving. And that makes it feel like we're on really shaky ground. So, you know, as we think to the grants ending and thinking about what that means for us, we have in Needham, 2 of the programs have just announced that they're cutting back ages that they're serving. They're no longer serving infants and toddlers, and they're shortening times. So they'll no longer be open till 6, but parents are expected to pick up it by 3:30. And we know that that doesn't allow people to work. You can't leave Boston at 3 to get to Needham to pick up your child at 3:30. So it's creating a very stressful situation. And at the same time, teachers can't live in our community. So they're, of course, going to be looking for jobs in their own communities. And there was, just before I came on this call, there was a text message from some of the directors in the area. And one of the directors said, I'm interviewing an applicant. She's wonderful. She has 5 years of experience and she's asking for $30 an hour. What do I do? There's no way I can pay that amount. And it's very striking to see you need I think it was $35 an hour to live in Massachusetts minimum. And they're only asking for 30 in a lot of ways. They're not asking for much. And we know that they could make that in a remote job with no COVID risk and no illness risk, and be home with their families and save on their own costs of commuting and childcare. But yet we're not offering that to people who are doing really important, special, amazing work. And so it just, as I said, it leaves me feeling that we're on very shaky ground, that this money could be disappearing, and that we can't hire knowing we don't know whether we have the funds or not. And it's a scary place to be.
Thanks, Ellen. Kate, I'll turn to you. And then before I answer the next question, we'll talk a little bit more about the context of where we are right now in Massachusetts with the grants. So Kate, let's hear more about you, about the program that you're working with and the impact of the C3 grants.
Great, thank you. And thank you to everyone, Chairwoman Peisch, Chairman Lewis, if you're here. And I have to say a special thank you to Lauren and Amy, because your leadership for the field over the course of the pandemic and getting us all to speak with one voice has been extraordinarily instrumental in supporting lots of the wonderful changes that both Chairwoman Peisch and Chairman Lewis have helped us get. So thank you to everybody. You know, at Horizons, we are really at the end of the spectrum in terms of the children that we're serving. So we serve 224 subsidized children whose families are living in deep poverty with an average income of about $18,000 a year. So the majority of our families are represented by single women in households experiencing homelessness. What that means for us is that we have to operate a 2-generation program where we support both the child and the parent to the best of our ability. 2-generation models have in fact been proven to produce much better outcomes for families in deep poverty, and we're fully committed to that. We're also fully committed to offering our children really extensive wraparound services in mental health, vision, dental, nutrition, and other aspects of their lives, because these children need it more than most, because they are indeed with their families at such risk at this time that we're serving them. So to afford such services, we employ a really sophisticated layered funding model. We put EEC vouchers in contracts. on top of Head Start, Early Head Start, and also Boston Public School UPK funding. Even with all that really sophisticated layered funding, that actually only covers 60% of the cost of what we're doing in our classrooms. So that leaves that other 40% to be provided at this point through private, corporate, and philanthropic funding each year, which I know many other providers do not have the ability to do. And that 40%, that cost represents the cost of operating the underlying business enterprise that it takes to support classrooms. You know, it's HR, it's technology, it's facilities, it's finance. We actually spend $500,000 a year just helping our families with 5 people working to get them the vouchers and the contracts that they need so that we can actually be paid. So simply put, the typical level of public funding is just not sufficient for operating much needed models of care for really vulnerable children. At the present moment, the C3 grants did just that. They addressed some of this gap. At Horizons, we were able to access $825,000 in these C3 grants. We believe in the SVI, by the way. The Social Vulnerability Index was a brilliant approach to this because it gave providers who served those most at-risk children slightly more due to the fact that those children needed the additional services. We chose to use the funding to support substantial increases in educator pay because we too had looked at that MIT wage calculator and realized that none of our teachers were living anywhere close to in a financially stable situation. And we felt we had to address it, and this money gave us the ability to do that. So we raised our minimum to $47,500 last spring, and by this spring it will be $50,000. So our starting salary for teachers is $50,000 and goes up from there. But what I can tell you is we still are operating with more limited hours than we ever did, and we still have a classroom closed because we can't find enough teachers, even with the salaries we're paying, to come work. So what the sustained support of C3 grants means for us is that we would be able to achieve the salary structure that was recently reviewed and recommended actually by the Center for Early Learning and Funding Equity that was at the EEC board meeting. We could actually use that money to get to the levels that they were suggesting might make the difference. The other challenge I think we all have to accept is that not only are teachers leaving the field, but in many cases, they're going to the K-12 system. Even though they love the youngest years and they know the importance of those youngest years, what they see in the public school system is that they have generous retirement packages. They're taken care of, not just for the years they're working, but beyond that, they have better benefits. So until we can try to get closer to par with those aspects of being really responsible employers, it's going to be hard for us to really have a pipeline of wonderful people to come into this field. So, you know, if the pandemic has taught any of us anything, it's that early education and this sector is what fuels not only a healthy economy, but it's healthy children. And much like the K-12 system, early education provides safe, engaging opportunities for learning for young children, but it also allows their parents to go to work and children to thrive. And I fundamentally believe, you know, if Massachusetts wants a vibrant early education system, it is critical that these foundational grants tiered based upon the needs of the children served are vitally important to just sustaining the momentum that we have built through some of the wonderful decisions that have been made by the legislature recently. So thank you. And Ellen and Melanie, I feel your pain every day. So
Thank you so much, Kate. And welcome, Senator Lewis. We were able to provide an introduction to you and Representative Alice Peisch, who joined us at the beginning of the call and is still with us. And it was, you know, an introduction that you will find familiar, just appreciating the work of the legislature. Being a leader during the pandemic was not easy. It's probably never easy, but to think about all the decisions that you made and your leadership. And so we'd love to hear some remarks from you, and want to thank you for your leadership along with your colleagues in the Senate.
Great. Thank you so much, Amy. And thank you to Lauren and everybody else. And so good to join you and along with my colleague, Representative Paish. And my apologies for being late. And I'm sorry for the speakers that I missed, because I know what you were sharing with all of us is so powerful and compelling. But you will be happy to know that I was just in a Senate session today, and I was talking with one of our newest members, Senator Robin Kennedy, who is a huge champion for the need for universal access to high quality, affordable early ed and childcare. And we were specifically discussing the need to continue funding C3 grants, both in the immediate near term, because we are facing a challenge with the funding in the FY23 budget only taking us through the end of April. So we've got a very near-term challenge to provide more funding for C3 grants in the current budget. And then, of course, to work to make operations grants a permanent part of our financing system for early education and care. So just to take a step back, I believe, as I know many of you do, that we should be thinking about early education and childcare in the same way we think now about public K through 12, which is that it's something that's critical for our society, obviously for our children and for families, and that we should be doing everything we can to work towards a vision of universal access to early education and out of school time that is high quality, that is accessible, and that is affordable for all of our families, and also is a system that is sustainable for the provider community, and that where we treat our early educator workforce with the respect and the dignity that they deserve, which obviously includes compensation and benefits. And that just can't happen in the kind of system we have now. We have a fundamental market failure, right? As many of you know and have pointed out, where you cannot afford to sustainably operate as a childcare provider and pay the wages and benefits that our educators deserve, and charge families high enough tuitions to make that possible. It's broken. The math doesn't work, and that's why operations grants or foundation funding is so critical, because it basically addresses that fundamentally broken economics of the early education sector. So certainly I'm a strong supporter of not just continuing, but hopefully making the grants permanent so that they're sustainable and you can count on them year in and year out. That was, as you know, a recommendation made by the Special Legislative Commission that I had the privilege of chairing along with Representative Paish and a number of you served on. And I do think that we need to continue to do what we're doing today to make that case, to our colleagues in the legislature and the Healy administration. But I think we've got a lot of thanks to all of your great advocacy, a lot of our policymakers and business leaders and others, who understand, the critical nature of this funding. And so thank you all very much for the work you're doing.
Thank you, Senator. And hopefully you can see the hand clapping, party hats, and hearts that are floating up in appreciation for your comments. We had much love and appreciation for Chair Paish as well. Panelists, I'm going to come back to you for one more question, which is, what's the one thing we should know about the impact of C3 for each of your programs? And if you have a story to go along with it. But I just want to kind of reiterate what Senator Lewis shared with us about where we sit right now in Massachusetts. We are at the beginning of a legislative session. Governor Healy will release her budget recommendations on March 1st. As the senator mentioned, there will be a bit of a shortfall of the funding that was originally provided to get us through this fiscal year. And so we have advocacy opportunities that we'll share at the very end of this call for how we can right now, today, take action to just send the message that we're hearing today about how critical this funding stream has been and what it's going to take to make it permanent. But first, we need to think about getting through this fiscal year. We also really appreciate the stories that are being shared in chat, the questions that are being answered in Q&A. We will follow up anyone that registered. We had over 500 people register for this webinar. So we will follow up with the slides, information, and answers to some of the questions. I think the number one question is, what do we do if this funding is not there? The other thing I want to also mention, because we know we have folks from other states joining us, and while the Patriots may not be in the Super Bowl this year, Massachusetts is leading in other ways, including our state elected officials not putting in state dollars to take over for the federal relief dollars. So we know that many states are facing big cliffs from when federal funding will stop, that was designed to really stabilize our systems. We have seen in Massachusetts our elected leaders step up and fill in those federal gaps with state dollars. And so that makes it even more important around our advocacy at the state level, as well as the federal level. We know that Senator Warren filed a bill yesterday around childcare. So all of these pieces fit together in the context, and you can hear from the stories of the panelists and the stories in chat about how this sits in the middle of, parent affordability, supporting our early educator workforce, and thinking about quality. How are we really going to deliver these quality experiences? So panelists, back to you, and I'll have you volunteer who wants to go in what order. What is one thing, as we kind of are joined by 300 people right now, what do you want to say about this funding source as we think about the future?
I can go.
Thanks, Melanie.
Yeah, so thinking about, the future with this funding, it is super critical, like Ellen and Kate said, like it is an uncertainty, and if, this money was, if we were not to receive this money for next year, like it really puts us in a position to rethink the positions that we have at our school. As is, we are under enrollment. We had to put a pause on our enrollment because we are short-staffed. And we're working off a wait list. So, if the funding doesn't continue, again, are we able to maintain the teachers that we have? Are we going to be able to hire new teachers to be able to go up to, our max of capacity? And that's all a question. Whether or not, getting rid of certain positions, can impact the quality of care. That's something that we really strive for. As we all know, we know how so important early education is, and to be able to have programs impacted because we can't have full staff, it can really hurt. And then that way too, our families and communities, they suffer. Our doors are not going to be open to have full capacity to be able to serve the families that we have, give them the care that they deserve, being able to give them the foundation for their social, emotional, be able to identify their feelings to move on and be productive. We want everyone who comes through our school to be able to flourish. Like we want, to make sure that, children too who leave our care, they're going to be successful. And again, with this money, it helps ensure that our teachers can give that kind of care to our families and children to be able to achieve that.
Thanks, Melanie. Kate?
So I'm going to go back to some of what you talked about in the beginning on that one, because I fundamentally believe that if the C3 grant program went away, you would see it impact affordability. You'd see it impact access. You'd definitely see it impact wages. And all of that is what drives quality, right? At the end of the day, if you don't have good, well-trained teachers who stay in their positions and are educated and continuously educated on an ongoing basis, the quality suffers, the children suffer. So I look at the loss of these grants as literally taking the momentum out of the system that's been created, and actually, in some cases, having a huge impact, negative impact on access in the short term. People will close classrooms and their doors.
And I think, Ellen, will go to you. When we look at the data, and we'll share our data, the data is available from the December EEC board meeting. We can put that link in chat as well. but some of the consequences of the funding of not raising parent tuition. Many programs reported they didn't have to, but that they would have to. And as the senator said, you know, this is a careful balance of what funding that you're bringing in and funding that's, you know, you have to put out. And so I think, as Kate mentioned, it isn't just about one piece. And we know the permanent piece is, we've heard this over and over, that you can't, because it's a year-to-year funding stream right now, it's really hard to put that money into straight salaries. That there, you know, we've heard ways that programs are figuring out how to acknowledge the salary deltas, but that, you know, as any director who has a board of directors governing them, you know, what kind of leadership, if you don't know if you're going to have that funding, it's really hard to put it in an operating budget. So Ellen, I'll turn it over to you for kind of this final, what's one thing you want to know? And I know we'll hear from Amaris and Lauren in a minute.
I'm sitting here thinking that we're at a huge disadvantage because we live in the United States. And I'm so sad to say that, but we're the only country, the only wealthy country that doesn't support early education and childcare. And I think Massachusetts has this incredible opportunity to really lead the way in these United States for other states and for other initiatives like this, but we have this really limited window. And teachers are giving up dollars to stay in the field. They are saying no to other jobs, giving up real cash to stay as teachers. And if we don't do something quickly, they'll leave. So I feel like we have to jump on this window before we lose more of the workforce, or as everyone has said, the classrooms are going to close, the schools are going to close, and then we will not have workers. Forget childcare. We will not have parents available to work in any of our other sectors in the state. So I feel like we have this obligation and opportunity to really lead the charge here.
Great, thanks so much for that, Ellen. And I really want to appreciate all the stories being shared in chat. I'm also going to add into the chat, we are working on a sign-on letter to think about how we can advocate to make sure we get through this fiscal year. And so I'll put that in chat. So first you can read the letter, and then there's a sign-on form. You can sign in as an individual or as an organization, as a representative. But please join me in showing some love and party hats for our incredible panelists, who we know it's hard for even to find an hour to be on a panel and share your story at an event like this. And thanks both to Representative Paish and Senator Lewis. And now I will turn it back over to Lauren.
And I will just end with a huge thank you for everybody who joined us today, with a special thank you to the providers, family child care providers, the caregivers, the caretakers who joined us. You are the heroes in this work, and we are so excited to be able to support you. Just as a last housekeeping item, we will circulate the recording. We'll be able to circulate the recording in Spanish as well, along with some materials that you can click on to find the data set that Amaris went through today. So Amaris, if you have any last words, I think that this ends our program today.
Well, I was just going to share, and thank you so much to the providers. I think this is going to feel anticlimactic, but I do want to talk about briefly the opportunities we have before us as we think about continuing the C3 grants. And I hope that everyone sort of heard in some that their operations grants are critical to equity and access. They're critical to stabilizing the workforce, and they're critical for family affordability. And some of the immediate opportunities we have to continue support for the operations grants have been shared by our speakers today. So let me just recap those. We can fund the program through the end of this fiscal year 2023. And that is, we hope, is likely to be done through a supplemental budget. We hope to see robust funding in the budget for the upcoming fiscal year 2024. And we hope to see passage of House Bill 2794 and Senate Bill 667, which is the legislation currently before the Senate and the House, respectively, for early education reform. So each of those are opportunities for advocacy for all of you providers on the call and everyone else to understand what's sort of next. I will stop there, but I will see if Amy or Lauren want any last words to add to this particular topic.
No more, sorry, Amaris.
No worries.
But
Thank you.
that I think officially concludes the program, unless Amy, I have also ended it prematurely for you. All right, thank you everybody for joining us.
Thank you.
Thank you, Senator. I think we're in the back in the practice session, or no? Are we still live?
We're
We're
live.
still live.
Crystal.